Hello and welcome. My name is Jayson Ray Abellar and I'm a second year nursing student. And for today's video, I'll be performing Leopold's maneuver. But before that, let me ask you, what is Leopold's maneuver? Well, I'm glad you asked. Leopold's maneuver is a systematic method of observation and palpation to determine the fetus presentation, lie, and also the attitude. It is important with correct assessment and in conjunction to assess whether the delivery is going to be complicated or whether a cesarean delivery is necessary. Also, the Leopold's maneuver is preferably performed after 24 weeks gestation, since by that time the fetal outline can be palpated. First, we need to wash our hands. Hand hygiene. Next is to verify the patient, explain the procedure, and also encourage the patient to void before starting the procedure. Now, hello ma'am, my name is Jayson Ray Abellar. I'll be your student nurse for today. Can you please verify your name and date of birth?
I'm Kate Stephen, and I was born on August 28, 2000.
Okay, hello Miss Stephen. So now, Miss Stephen, I'll be performing Leopold's maneuver, and by this case, I'll be placing both of my hands, palms, on your tummy, stomach. Is that okay with you?
Yeah, it's okay.
Okay. This procedure helps us determine what position your baby is in. Okay? You understand?
Yes.
Okay. Before we start, you need to go to the shower. Do you have the need to pee or?
I already peed earlier.
Okay. Thank you, ma'am. Next is to ensure privacy. So, as if there are curtains, it is important to provide modesty, to preserve modesty for the patient, since this procedure can be embarrassing for some. Next step is to assist the patient in a supine position. Now, Miss Keith, can you please lie down?
Okay.
I'll be using this pillow for comfort for your head.
Okay.
Okay. Now you may now start. At this point, you may now start to drape the patient. So, Miss Keith, I'm going to start removing the cover. Again, I must say, it is important to preserve modesty for patients. So I'll just have to go right over here. So now I've just exposed the abdomen. So next is to warm our hands, because cold hands stimulate uterine contractions. And it's important to note that to use your palms, not the fingertips, just the palms, when palpating. So the first maneuver determines the presentation. So I shall face the head of the mother with my warm hands, palpating from the abdomen just below the xiphoid process in a diamond-shaped form. So what I'm looking here for is within three things to observe. One is the relative consistency, whether it is the head or buttocks. In a cephalic position, the head is harder, in breech position is softer. Now, the second observation should be the shape. If it's round, the head, yes, and also the breech is really hard, soft. If the head is right over here, we can notice and palpate the neck of it, and also the mobility. If the head is independently moving in the body. So ma'am, I'm going to be performing the second maneuver, the umbilical grip. So this maneuver is important to understand and to determine where is the fetal back, the position of the fetal back. So one hand is placed on the other side of the abdomen, and the other hand is to move upwards to down to rotate on the uterus. Know where the other fetal parts is and the fetal back. Now the fetal back is hard and long. And also the fetal back is important to palpate to understand its location because that is where we will put our heart rate, fetal heart rate monitor to have an accurate result or accurate tracing of it. So in the third maneuver, which is the Pelvic script, now this is to determine if the fetal head is engaged or not. Now, you do this, you use your thumb and your two fingers, make an L, place them in the lower portion of the abdomen, just above the symphysis pubis. Move them to the left and to the right. Now, if the head is not movable, that means it is engaged. If it is movable, that means it is not engaged. Now in the fourth maneuver, the pelvic grip, we need to face on our client's feet and place 3 fingers 2 inches above the inguinal ligament, pushing pressure downward to the birth canal. Now, the fourth maneuver determines the attitude. This helps us understand if the brow is corresponding to the second maneuver where the feet and elbows are. In other words, we determine the cephalic prominence. Now, the brow should be on the opposite side of the back. Stop. After doing the fourth maneuver, help assist the mother in a comfortable position now. Ma'am, I'm done with my examination. May I help assisting you?
Yes.
Okay. Just have to cover those. And your blanket.
Thank you.
Okay. Next is to confirm the presentation and document the findings. Now, ma'am, what I've gathered and observed is that your baby is in cephalic position, which means the baby's bottom or the buttocks is on the top and the head is in your pelvis. Now, in the third maneuver, the baby's head is immovable. That means that the baby's head is engaged. And also, the fetus back is right over here on the right side. Now, the attitude is good because the brow is on the opposite side of the back. So overall, the examination is done, and thank you for your participation, ma'am. So, again, document what I've said earlier, and also put the time, date, and the name of the examiner. Thank you for watching.